a good day that we pray and bless. We say thank God for this beautiful day that you've given unto us. Let's get going. And as you know, this is a channel. This is the Benjamin the Wise Guy. Benjamin the Wise Guy is a channel that talks about medical issues. A channel that talks about medical issues. So my guys, you guy, my guy. I really like saying, you guy, my guy. You guy, my guy. You see, you're there, I'm here, everywhere at this world, your world in mine. So today we're gonna do something that is called essential hypertension. Essential. Someone may ask me, hey, doc, essential how? Hypertension is not an essential in life. We're gonna know. Welcome, Jamaican uncle. Welcome to the chat. Thanks for tuning in. This is Benjamin the Wise Guy's channel. Benjamin the Wise Guy's channel. We talked about hypertension yesterday. We introduced hypertension, and we said hypertension is the force that blood exerts on your vessels, blood vessels, when the heart is pumping. So it is written as, let me check if I still have those references. References are very important. Hey, my friend, you gotta have so many references. Just look at this. These are the pictures that we've been using to explain. Hey, this is a lot of work. Peter, hi Peter. Welcome to the channel, Peter. I can see it's a beautiful day, Peter, and we still keep healthy. Peter, and taking some good warm water. Good warm water. It's having a beautiful day. Peter, tell me which side you're coming from. Remind me. And today we are continuing with hypertension. Just to remind some people, today we did introduce what is high blood pressure is. High blood pressure in Norway. Peter from Norway, big at all the time. Hit the like button and just sit around and watch how we keep ourselves healthy. So this channel called Benjamin the Wise Guy gives health tips, talks about some normal problems that can be solved. So if you are there, you are new to the channel, imagine I'm at 1,400 and the kind of good work I'm doing. The kind of good work I'm doing, my friend. Subscribe to the channel and you'll get some notifications. Now, today, if you are new, my friends, don't fail to subscribe. Give me your subscription, hit the like button. Let me get those likes. Check on my channel, see what we do here in this channel. Just go through the channel, see the good talks that we've had, how people get healthy, how people get to know, how your bodies live. If you have a condition, how you can live with it, or how you can socially have good mental health, which is a problem in the current society. And you've seen yesterday, the questions that came after the talk. Most of them were social questions, community questions. Imagine hypertension being linked to social issues. Just imagine. So welcome, my guys. Welcome where you are. Tell me where you are watching from. Tell me where you are watching from. Are you watching from Kenya, India, Africa, Asian countries, US, everywhere? Tell me, come to the chat, tell me where you are watching. So yesterday we discussed about hypertension, and we said high blood pressure is from the normal, the pressure that is high, that is exerted on your blood vessels, like the blood vessels. Rosanna is here. Rosanna, long time. Rosanna is smiling at me. Let me smile back, Rosanna. Welcome to the channel. Yes, she has retracted that message. Let's get to know that when you want to have a good health in your brain, you have to live healthy, and health is a smile. Smile always. Just give a smile always. Rosanna, hello, welcome. I'm here. I'm looking at you, and we have Jamaican we have Peter from Norway. So the force that is exerted at your blood vessels is called blood pressure. We have normal blood pressure, we have elevated blood pressure, and we have low blood pressure. So yesterday we were talking about blood pressure, and then we said we have high blood pressure. So the normal blood pressure, let me write a normal blood pressure between 100 over 65 to 120 over 8. Now, this is what I'm writing. 100 over 65 over 120 over 8. Now, the one that is above the 100 is called, the one that is above. We talked about it. Let someone say systolic and diastolic. Systole, when the heart is pumping, poo, poo, poo. When the heart is pumping, systole. I can see so many people checking in. Please tell us where you're watching from, and imagine we are at 1,400 and you have not subscribed, my guy. Subscribe, give me your subscription, come to the chat, talk to the people that are at the chat, tell them where you are watching from. I like knowing where you are watching from. If you are from my region, I'll really be happy. Phone Robinson, Uncle, I casting a spell on you. Now, Phobin Robinson, here we talk about medical issues. Spells don't work here. If you are a juju man, spells don't work in medicine. You just come, subscribe, hit the like button. Stop doing these things you are doing. They are not helpful. So, welcome. If you have not subscribed, my friends, please subscribe. Let's go to 1,500, 1,600, you are not going to sleep. You know what I'll do? I'll time you out. Because if you continue texting those things you are texting, I'll time you out. So stop texting what you are texting. That is nonsense for B. Robinson. That is nonsense. That is all the way from Nigeria. Nigerians are, you believe in no. Okay, let's continue, my friends. If you have not subscribed, subscribe. Just give me your subscription. Hit the like button, and we do what? We continue. CJ Rehab, hello Dr. Benjamin. Hi CJ. CJ, hope today you have a lot of questions for me. Let's just not listen. Let's engage, my friends. Let's engage. Let this talk be 1, 2, 1, 2, 1, 2, 3, 4. Questions, and relate with everyone. Relate with everyone who is in the chat. Those are guys that are new. Please don't just drop and go. Eavesdrop and leave me your subscription. Then you can come back and rewatch. You can come back and see what we are doing in this channel. Of course, we do medical talks, and so these medical talks can do what? Can help you in another way, can help you one or the other way. So, friends and everyone who is watching, if you have not subscribed, hit that subscription button. That subscription button, hit it, and come to the chat. Tell us where you are watching from and ask a question. The topic of today is essential hypertension. Essential hypertension is the topic of today, and we kind of get the recap. Yes, no worries, man. Jai is out, guys, and is all of control. Jamaican uncle says so. You see, Jai is in air for everyone. Hit the like button. Don't just watch and you've not liked. Hit the like button, my friend. Let's get more impression. Let's make more people to know that we are here and we give good talks and we relate. Go to the chat. Tell people that I'm watching Dr. Benjamin from the US. I'm watching Dr. Benjamin from this side. It is good. So, what is blood pressure? Blood pressure is the pressure exerted on the blood vessels as the blood is being pumped. What are blood vessels? Blood vessels are arteries, veins, and capillaries. Those are blood vessels, my friends. Blood vessels are arteries, veins, and capillaries. Those are the blood vessels that really get the pressures. Now I want to say something. Let me bring the blood pressure, because as we talk we should do. So I'm going for the blood pressure machine. The blood pressure. Yes, the doctor is back. The doctor is back. Now, look at this. I want you to check at this one. I want you to look at this machine. How can you look at it in a good way? Let me use something that can elevate it. Something. Today we're gonna learn. We're gonna learn some things. I'm looking for something that can elevate it. Let me use this one. One, put it here. Put it here so that people can learn. Now, I want to explain what blood pressure is. This one is called a sphygmomanometer. See, it has some guidance here. This one, this one is what they do. And then we have cuffs. These ones are called cuffs. These ones are called cuffs. So this machine is a blood pressure machine. Let's learn. Agnes Thomas, welcome. Greetings and welcome to the channel. If you are new to the channel, my friends, please don't just go. Don't just go. Please subscribe to the channel. Give me your subscription. Let's learn. It can give you some heads up. Agnes Thomas, welcome to the channel. Now, you see, this machine has some readings, and if you look at it so well, you will see it has mercury inside. If you let me show you this. It has some mercury inside. So when you pump, you can see. Let me pump again. You can see something is jacking here. This thing that is jacking is called mercury. It's called mercury. So this one is a BP machine. People call it manual BP machine because then I'm your family in the chat. I'm your yes, Agnes, yes, good, Agnes Thomas. Now, when you're taking this machine, and you're putting it on someone's hand like this, the cuffs. I don't know if you are watching. Let me use myself. Everyone is busy. Yeah, let me use myself now. You see, these are the cuffs. I've put the cuffs on my hand like this, on my hand like this. I want to explain blood pressure and how it is measured on my hand like this. I want to explain blood pressure. So I've put myself this. The cuffs, you see, the cuffs. I've put myself the cuffs. So this cuffs has a pipe that is connected to the here. The sphygmomanometer here has a pipe, and this is the pipe that is connected here. You see, it's connected to here. Now, as I'm pumping, you see it has mercury. As I'm pumping. See, I'm using this ball to pump. I'm using the ball to pump. Yes, this is here. I'm using the ball to pump. As I'm pumping, you can see You can see it is being inflated, and it is causing tension towards my hand. It is causing tension. So most of the blood here, when it is being pumped and it is getting pumped, it is making blood from the veins not to flow. So what do? You take the stethoscope, you listen. Take the stethoscope. Now I'm explaining. You put them on your here, and then you place them here to hear the beat. So when the patient is seated and I'm releasing this. I'm listening to the beat here. So when I'm releasing, let me pump. You will see the mercury. You will see the mercury jacking up when I'm releasing. There is a place I release here. You know, when I've pumped it like this, no blood is going through. So the heart pressure is like it is pumping, but you have deflected and it is causing a barrier. So all the blood vessels here are constricted. They are constrained from pumping blood. So when you release, look, see, you listen with your stethoscope. The stethoscope, you listen to the beat. What happens here is when it is going down, you will find that when it is going down, and you are listening to the beat, you will start listening to when now the beat has started going. Why? Because now the blood has started going through the veins. It means when the heart is pumping, when it will start pumping, when the heart will start pumping, you get? Because now you have deflected and it is making your veins not to continue pumping. This one is a blood pressure machine. It's a blood pressure machine. I'm talking about blood pressure. So when you deflate this round, you see it is, let me put these things aside so that people can view it well. Sometimes it's good to make people understand. So you see this machine, let me put it like this. Put this machine like this. Like this. You see this machine, when you are pumping pressure, it is causing this to deflate. Look at this. I'm causing pressure. And when I'm causing pressure around here, it is making blood not to go. So if the heart is pumping, blood cannot go because you have inflated and the blood vessels are constricted. So if the blood vessels are constricted, let me draw it so that people can understand. If the blood vessels are constricted and they cannot pump blood, what does it mean? The heart at that period has no capacity to, but when you release the pressure, from this point, when you release the pressure from this point, it means when you hear heart sounds from here, it means that is when the heart has started pumping. When the heart has started pumping, and that is what we call systole, when the heart is pumping. So you release until now the beat is not heard again. It is called systole. When the heart is resting, the beat is not heard again. It is called systole. So this is a blood pressure machine, and this is the readings. We read them here. The readings, mercury is here, which gives us the reading. As it goes down, it gives us the reading. And then this stethoscope is in the ears to hear when the beat starts and when the beat stops. So when the heart starts to beat, we get the reading, and when the heart stops to beat, we get the reading, asystole and diastole. asystole and diastole. So my people, let's get to continue with the topic. Let's get to know what is hypertension and what is normal blood pressure, and then we will do essential. If you have a question like the one that my friend Rosanna has asked, please don't feel ashamed to ask, just ask. So this one is what we use to measure here our blood. This one is not an automatic one, the one of machine. I like this one because I'm listening to your heart by myself, the beat by myself. So this is it. This is called a blood pressure machine. Blood pressure machine. And as we learn, we will continue to know more. So I've explained. So the normal blood pressures are supposed to be 100/60 to 120 over 80. 120 over 80. So 100/60 over 120 over 80. Now 120 over 80. This one over 80. Anything above that, we start knowing you have a problem with what? This one, let it be here. Let this one beside me here. Anything besides that, we gotta know that this person has a problem, and this problem is of being diabetic. So look, measuring of sphygmomanometer, this one, and you should use a stethoscope to listen to when Nene and Mom, doctor, how are you today? I'm fine, Nene, hope you will not run away. Today we are not having injections and needles. So this is it. This is the sphygmomanometer that measures BP. Now, let's get to know this. The force that is exerted on your blood vessels is what we call blood pressure. But there is high blood pressure. And why is high blood pressure having a problem? Why is blood pressure having a real problem? It is because blood pressure is can go very high, and then it can bring problems. Your veins can burst. You can get an aneurysm, internal bleeding, because high blood pressure can damage your brain. So right about now, let me get just a minute. I get something else. Now, I'm back, and there is something else. I will not run away. Please don't run away. Dr. Rosanna was just, no, there is something else. This one is called a pulse oximeter. So this one gets your pulse, how your heart beats and the pulse. Look, I want you to see some things. I want to explain some things about blood pressure. So be keen. If you look let me see. If you look keenly, you can see 95, 84. 95 and 84. Look keenly. And if you look so keenly, again, I don't know if you can see. If you look so keenly, you will see some lines that are passing there. Some lines that are passing. You look. You will see the yellow one and so my pulse here is 79 and my oxygen is 94. This one is called a pulse oximeter. This one is for BP. So it is a pulse is a rhythmic expansion and recoil of arteries caused by beating of the heart. So this one is called a pulse oximeter. What this pulse oximeter does, this one, I know some people don't know, but people have them in their homes. If you have any question, please, greetings at the Thomas, please ask. So what this pulse oximeter does, you know, when your blood is pumping blood in your veins, when blood is being pumped in your veins, let me use your hand. I know how to draw. Hey, if you are watching and you've not liked and subscribed, my friend, please subscribe and like. Come, like. Give me your like button. How are you watching and you have not liked my video? So this one, I want to explain something about the pulse oximeter. This one. And I want to explain something about this machine. So I'm drawing something. You know, I love drawing. So please, we are 12 and 6 likes. Please increase the likes. Increase. Double tap your screen and you watch what I'm doing. And you check on the screen. Check on the screen. Check on this. You see, it is reading there 94. So this is my hand. Let me tell you. This is my hand. I'm drawing my hand. I don't have much muscles. I don't have much muscles. Don't have much muscles. So this pulse oximeter, we have veins. I'm drawing something. I'm drawing something that is very important. I want to explain something that is very important. So look at this. This is my hand. When you put these curves here, this is my hand. It's not seen well. I need some other means. I have some my markers. My markers are not here. So when you put these curves at your hand like this, you see, at your hand like this, what happens? What happens is you are forcing these blood vessels not to pass blood. So when I'm putting this pulse oximeter on my finger here, at this finger here, it is measuring the force that the heart is pumping. So a pulse oximeter is the rhythm, expansion and recoil of the artery caused by beating of the heart, caused by how the beating of the heart. So these veins, lessons illustration in form of diagram, easy to understand. Yes. So when this one is, I've put this on my finger here. What happens? As the heart is beating and pushing blood, even this thing feels it at your finger. So that pushing and beating, rhythm expansion, when you push something, there is like expansion and relaxation, expansion and relaxation. So this pulse oximeter measures the rhythms, and that's why it is called pulse. Pulse is the rhythmic expansion and recoil of arteries caused by beating of the heart. Please, you are not liking and you are just watching. Why? So we say that the expansion, the rhythmic expansion and relaxation is called the pulse. So your high blood pressure can be so high, but the pulse is normal. If your pulse is so high, it means you have done a lot of work, or you have been running, so your head needs more oxygen, so the heart is pumping so fast so that it can push blood in your head, for oxygen. And then you see it is measuring oxygen level. So my oxygen levels are 95, my pulse rate is 72. So it means when the heart, the normal pulse goes with the heart beats the normal one is 60 to 100 beats per minute. So they expand, it relaxes. So that beat, when the heart pressures, it expands, it relaxes, it expands, it relaxes. And then the heart is beating, the arteries expand a bit. When it relaxes, they relax. You understand? You get my illustration, eh? So when you put this on your finger like this, it measures, it checks. There is like a light. I don't know if you are seeing that light inside there. Let me see. You have not seen it. Let me see. Infrared light somewhere there. Come on, show people this thing. Please show people this thing. It's not bringing right. Let me see. I want you to see that kind of infrared. Good, it's coming. Look, there is an infrared light inside. That is what we call, it is measuring the expansion of the veins and arteries, and that's where we get. So the normal one, your heart beats from 60 to 100 beats per minute. So for me, let's check mine. We see if my pulse rate is okay. We saw it was around 70. You press, and then if you press, it will bring. Now my oxygen is 96 and my pulse rate is 73. My pulse rate is 73. So it is within 60 to 100 beats per minute. So my heart is healthy and my pulse rate is normal. I'm not running, I'm not doing anything. Now that is a pulse. But sometimes you can do it manual. You can touch and feel the beat of the pulse. Radial pulse here. You can feel it, and then you count. You count for 1 minute. How many beats have you had from the pulse? And then it is. Big up, Dr. Marjay. Welcome to. I hadn't seen Marjay. You are here. Thanks for being here. So we are talking about this one for pulse, for hypertension, and this one for pulse rate. Pulse, we have said, is the beat that the expanding and relaxation of the arteries. Now, as we talk about the pulse rate and the beats, we are still want to talk about essential hypertension. Now, look about this. This is my arm. I have inflected, and this one is holding. So blood is not passing. But when you release and you start hearing with a stethoscope here, you take this stethoscope and then you put in your, and then you put here. It is put on the bronchial part here. What you want to listen is, because now these cuffs have hold your hands. These cuffs have hold tightly and blood is not passing. What you want to listen to, welcome J. King Rev. Thanks for being here. What you want to listen to is when you have inflated, let me inflate this again. Let me inflate this again. And I want you to check so well. Simple Kate, welcome to the chat, Simple Kate. Simple Kate is here. Simple is not a simple one. Simple is a wonderful woman. Is a big woman, a woman of God, a wonderful woman, a miraculous woman is Simple Kate. Now, you take. You see, I've inflated. Now, I want to stop blood to flow to this side. And this is how we continuously know about blood pressure. Now, as I'm using this to put air inside here, I'm putting air. You see, I'm putting air. And as I'm putting air, you can see some mercury here jacking up. Look at it. You can see some mercury coming up, jacking up, jacking up. God's favor, sister. Ooh, look. And now I can feel numbness in my arms, because now blood is not going through. Now look. Now blood is not going even a second. It has stopped. So you take this, the bed. This is called a stethoscope, and your patient now is there. You place it here. You will not be here. Don't need unclean. The uncle himself. You will not hear anything. I'm not feeling anything because blood has stopped moving. But get this right, my friend. When you take now, you see our mercury is still there. Our mercury is still there, like this. Our mercury is still there. Where is it? We have pumped up to around, that is 100. We have pumped up to 100, and that is 190. That is not my blood pressure now. I start releasing it slowly. Why? Because now I'm not listening to anything that is going. Blood has stopped flowing to my hand because I have inflected, and this one is compressing the arteries. So when I'm releasing them so slowly, you will see, look at the mercury. It's coming down, it's coming down, it's coming down. Now you can see it playing somewhere. Look. Now the mercury is playing like jacking like this. Look. We go down. If you look closely, you will see it jacking like do. Now, when you start feeling from your ears, when you start feeling from your ears, you see it's jacking up. Now the heart has started getting the force of pumping blood. That is where we call systole. Systole is when the heart now is pumping blood. So the force of the heart of pumping is at that one. That is where the heart the pressure where the heart can be able to pump blood to my arms to go there. The heart muscles can be able to be pumped. Where? Now, you continue listening. It will go to until now you feel that you are not listening to that to again. It means where it stops, where the to stops, the heart sound stops, is where the heart is relaxing. Because now you cannot hear the sound again. Now that is how we know diastole and systole, how the heart is pumping. Now, my fellow friends, you understand how we get blood pressure, the heart muscles and blood pressure, how the pressure is exerted. And now you relate how I've used this one, because this one is a manual one. Blood pressure is the pressure of how the heart pumps and the pressure that is exerted on your arms. Any question, my friends? Any questions, my friends? And then I've introduced you to this gadget. This gadget is called a pulse oximeter. You can do it manual, or you can do it with, manual, or you can do it with This one. We have learned about that. Now, pulse oximeter and blood pressure machine. Let's ask, and then I've illustrated how. You see? So, these are the veins, and when you put these curves here, you are making blood not to move. So, when you are releasing pressure here, now you get the heart where it can start, and that's when we measure here. This shows us where the heart has the power to push blood now when it is pushing, and you will hear it. Do acids have any relationship to high blood pressure in persons on nifedipine? Yes, I'll answer that. So let's continue. Just be here. I will answer that. Very soon. Now let's continue, my friends. Does it mean let me use the computer. That is asking, does it mean when the heart pumps high or forcefully, it's struggling? Yes, it is struggling. When it is pumping with force, it is struggling. There is a force that the heart needs to pump blood with. And that's why we have said, if your pressures are 100 to 120, the systole, when it is contracting, it means it's at normal. And this 100 means per mercury. It is pressure per mercury tones, the mercury that you are reading here. And when it is systole, when it is resting, supposed to be between 65 and 80, which is normal. So that is what I'm explaining about the blood pressure. If you have not understood, please just ask. You know, these things are, this one, my friend Marwa calls master classes. Now, Simple Kate told me just yesterday, I'm giving you master classes. Thanks, Simple Kate. Yesterday I was so tired when I was getting home. I wish I could stay for some time. Now, we have talked about that. Now, let's talk about something. If you have not understood something about those two, please ask me. Now, we want to talk about essential. Doc, I do understand. Thank you, man. Thank you. When people understand, you feel good. You know you are a good teacher. You are a good teacher. Am I a teacher? Okay. Welcome, my friends. Welcome, everyone. Today, this machine will be here till the end. This one, this one. Something else I want to talk about, which is important, is essential hypertension. We talked about two types of hypertension. So one is essential hypertension and the other one is secondary. Essential and secondary. Essential hypertension is the hypertension whereby yes, let's continue to hit those like buttons that you come in. Let's continue to, and if you have a question, ask. Like let me answer this because I can forget. You know, does it mean when the heart pumps blood forcefully struggling? Yes, it is. Do acids and have any relationships to high blood pressure in persons of nifedipine? Doctor, nifedipine is called calcium channel blockers. When we will come to drugs, you'll see how it works. So acids can make you have high blood pressure because of pain. When you have acidic stomach and you are getting pain can get you to have high blood pressure, not the drug. The drug does not give you the pain. But you know, when your pressure is so high, you get epigastric pain. So they are like sisters and brothers. The relationship is one or two. You get? So that is it. Now, essential hypertension. Nene and Mom, have I answered that question correctly? When you have acidic stomach, your pressures go high. When you have acidic stomach, your pressures go high. When you have high blood pressure, you feel epigastric pain. I'll explain. Yes. So nifedipine should reduce it, but nifedipine does not the acidity. The acidity comes from other things. You see? Yes, Marcia Thompson. Good morning, Benjamin and everyone. Everyone, let's clap for Marcia Thompson. She has always been here with us for so long, and she's supporting everyone. Besides having no channel, she's always here with us. Please support Marcia Thompson. Welcoming Marcia Thompson with a clap and telling Marcia Thompson that we love you so much from Jamaica, the land we love. Yes, please everyone, welcome Marcia Thompson. Now, let's talk about essential hypertension. I think everyone has understood about this device and the other. If you are coming in, you can rewatch. Essential hypertension is persistently elevated blood pressure with no single identifiable secondary cause. It is the most common type of hypertension, accounting from 90% of patients going in a hospital, and then you are being told you are having a high blood pressure, and then you ask those people, how? I'm not feeling anything. I'm not feeling anything. How do I have high blood pressure? And then you are told, because your readings of systole and diastole are high, we need to see what is happening. But you know what brings essential blood pressure? Genetics. Some people in their family are born with genetic problems that creates high blood pressure. Lifestyle factors. Yes, Simple Kate said yesterday, kurudishia mwili pole. In Kenya we say you are hey my friend, you guys that are in Kenya, man, help me translate that. Kurudishia mwili pole. How can I put it? When you have been struggling so much in years, and now you have some finances, you want now to live large. You want to tell your body, please help me translate kurudishia mwili. People, King Ray, everyone who is watching and is in Kenya, help me translate kurudishia mwili pole. You want to live large and now eat whatever you are not eating. You want to drink alcohol. You want to take the most fine wine. You see? You want to get the best woman if you are a man, like a fine wine. They say the woman is beautiful and fine like fine wine. Yes. And then you start having... Nene is laughing at me. Nene, help me translate that. Kurudisha mwili pole. Now you accumulate some cholesterol, you start having lifestyle diseases, your kidneys starts to have problems, all of those. Environmental factors is another thing that can cause you to have high blood pressure, and abnormal regulation of blood vessels, kidneys, hormones, and nerve. Now, in genetics, I will just give an overview of genetics. But this genetics will have a very serious session, because some people have blood pressure and they say, you know me, I got it from my parents. I cannot do anything. Blessings, I'm 10 subs away to 1K. So proud of you. Thank you. So I will just bring this topic up and I will do it for itself. Genetics hypertension, it's a serious issue, and I'll do just a video for it. I'll just do a video for genetics hypertension alone. So genetics hypertension refers to high blood pressure that develops partly because inherited genes passed from parents to children. Some have been passed from parents to children. Most commons are polygenic, meaning many contribute small effects that together increase a risk of hypertension. Just know that this is a very big topic, so watch out for when the video is coming out. I refuse to fall into the trap of genetics. Amen. Let me say that. Amen. Now, if you are watching and you are new to the channel, my friends, if you are watching and you have not said where you are watching from, come to the chat. Tell us where you are watching from. You are watching from Kenya? Are you watching from... This is a YouTube video that is called Benjamin the Wise Guy. And if you have a question, it is your time to hit and tell me what question you have. Now continue subscribing, and the new guys hit the like button. It gives impressions. You understand? Yes. So genetic hypertension, it refers to high blood pressure, partly because you have inherited some genes. Most cases are polygenic genes. I mean, when I'm bringing this video of genetic hypertension, you'll understand what polygenic genes are. Meaning, many genes contribute to small effects together increase the risk of hypertension. We will learn about that when times come. So, we have said something that is called essential hypertension. Essential hypertension is something that you never know. You never understand where the hypertension is coming from. You just have high blood pressure. Lifestyle factors, environmental factors. The lifestyle factors I've explained about several issues that are like eating so much carbohydrates, sedentary lifestyle, no exercise, a lot of cholesterol brought by your eating habits, no exercise, environmental factors, altitude, high altitude and low altitude. All these factors can bring these problems. Abnormal regulation of blood vessels like kidneys, hormones and nerves. Now, there is a video you go and watch on renin-angiotensin system. Kidney, the liver and the lungs. The lungs releases a hormone called angiotensinogen. The kidney releases renin. And this one constricts the blood vessels. How does that come in? It is explained very clearly. Now, let's continue about essential hypertension. Why is it called essential? There is no clear single disease causing it. What's that? What's that? I've talked about several things. Simple cake. Which one? Please tell me about what you are referring. Essential hypertension or renin-angiotensin system. The renin-angiotensin system is a system that is they coexist. The lungs, the lungs, the liver, and the kidneys, they coexist and they work. I mean, we go and watch which video? Oh, the video of renin-angiotensin system. I'll be putting it after this. It is called renin. Oh, where are my papers of yesterday? Yes, simple case. Okay. I'll be putting it after this. And there is one we did some time back ago on renin-angiotensin. Where are my papers? There are so many. Just imagine all these papers are my illustrations of what I usually teach. All this, just imagine. So let me find this one. It is called renin-angiotensin aldosterone system. Renin-angiotensin and angiotensin system. Agnes Thomas today is here. Welcome, Agnes Thomas. Welcome. So that is the system that regulates your blood pressure. I tried to explain it yesterday. Now, let's take a look on something. Why is this kind of, we have said we have the main two types of hypertension. One is called essential hypertension. The other one is called secondary hypertension. So, essential hypertension is called essential hypertension because there is no clear disease that is causing it. You are just having high blood pressures. High. Unlike secondary hypertension, whereby we have a problem that is like kidney disease, we have a problem like hormonal disorders, we have certain drugs that you're taking and they are causing your pressure to go up. Pregnancy complications, when women are pregnant, they can have a high BP, and we call them eclampsia or preeclampsia. Those are the conditions that women have when they have these problems, eclampsia or preeclampsia. Now, anyone with any question as to this first essential hypertension? We have talked about genetics, we have talked about lifestyle, we have talked about, and we have talked about several things, my friend. We have talked about several things. So there is something we want to talk about else, but I want anyone to ask me any question because before I continue, I've answered 2 of the questions from Nene and Mom, and I've answered Simple Kate. Now let me get another question as I sip some warm water here. Yeah, as I sip some warm water here. The other thing that we want to talk about is very important. What are the causes and risk factors? Who are at risk? Who are at risk of having these problems? Who are at risk, my friends? Who are at risk of having these problems? Essential hypertension developed gradually over years. Who are at risk? 1, genetic factors. Genetic factors, like if you had a problem previously, maybe there is, you see, people in their bloodline, they can have something that is called polygenic genotypes or hormones or proteins. So they are passed to other generations. I will talk about it. The other history, family history of increased risk because of some genes that salt handling by kidneys is a problem. Blood vessel tones are just tough. You know, sometimes you can have body blood vessels, the arteries and the kidneys and the veins that are so tough, and they are pushing your head to have very high blood because your vessels on the head, they are not bigger than this one. So when the heart is pushing, you can get aneurysm. Hormone system that has a problem. Hormonal systems that have a problem. These are now carried from some genetics. And you see, hormones that we talked about are like antidiuretic hormone, aldosterone. There is a hormone called aldosterone which balances salt in your blood vessels. Your blood vessels, the veins and arteries, can release something that is called nitric oxide that helps your blood vessels to relax. That thing can have a problem. There is another one called endothelin that helps. It is released on your blood vessels. The one, if you have not gone through the last video, please go through it. It makes your blood vessels constrict. The relaxation and constriction. So these are the things that we look at and we see genetic issues. So someone has just said, I'm not saying your genetic issues. Blood pressure, there is no one blood pressure genetically. No. When I'm talking about genetic issues among blood pressures, it means maybe the vessels, you are born with vessels that are releasing more, the vessels that are releasing more endothelins, or they are releasing less nitric oxide. The balance is not there. Your bloodline, you are born with that problem. Or in your bloodline, you are born with the problem of releasing a hormone called renin. Renin in the kidney is really released. It's really released. And you know, renin, when it comes to with the angiotensinogen that is being released from the liver and they bind, it activates it to angiotensinogen 1, and then the angiotensinogen converting enzyme converts it to 2. And then your blood vessels do what? Constrict. And then blood vessel pressure goes high. So genetically, some people are born with that hormone that is really being produced at high rate. So you will never say that in our family we know we are born with blood pressures that are high, so we cannot do something. No, it means one of these. The hormonal system has a problem somewhere. So before you wait that your brain can get aneurysm or your blood pressures can go so high, and then you start having problems in future, we need to find out in your bloodline do you have a problem with kidneys that are releasing renin so far high? Your liver is producing angiotensinogen or salt handling process of the kidney when the aldosterone is handling sodium is a problem. So we don't say generally we are born in a family where our genetic line, our blood pressures are high. No, there must be one single thing that is making someone is passing this to the other generation. Polygenic genes passing problems of the kidney, or the other family they have a problem with the blood vessels that are always releasing endothelins, are constricting the blood vessels every time. There is a family whereby the capacity of breaking down cholesterol is a problem, and the cholesterol are being clogging in the blood vessels, causing something called atherosclerosis, and the blood pressure goes high. So you don't say that we are, we don't say genetic issues is just blood pressure. You have to look, you have to do blood tests to this person, you have to do some blood tests to this person, so that you can know this person, yes, this person has essential blood pressure. This person having essential blood pressure, it means that my friend, hello, something happened and then we are back. So that is essential blood pressure. Now let's continue. Sorry for that break. Sometimes breaks are good. Sometimes breaks are good. Now everyone is understanding genetics and blood pressure. It's not just that you tell someone in your bloodline, you know, you have a problem of blood pressure. No. For real, this is called a master class. This is master class. It is really just a minute, I reply to this. Yes, now you understand about essential blood pressure and what I mean by when I say genetics is not just genetics. Let's understand when we talk about genetics what we mean. Let's not hide behind the doors of genetics. You go to a hospital, a doctor tells you you have a genetic, you in your bloodline, you have in your genetics, in your generation, genetically you are born to have high blood pressures. No, there are some imbalances, and everyone who has blood pressure that is genetic, it doesn't mean they share the same thing. It doesn't mean they share the same thing. Now you understand. Anyone with a question, my friends, please bring it up. Drop your questions, my friend. We continue. I know you are understanding and you are feeling it. You are understanding this right, left, and center. There is something else we have talked about, essential, and I wanted to emphasize on that, and the way why I will do that video on renin-angiotensinogen system. There are some factors that people need to understand that are so important. There are some factors people need to understand that are so important. Why do this person who is client X being given, they are genetically, their genetic line, they have blood pressure, which is passed. Our genetic line, we have blood pressure, which is passed from. But why is he using a different drug from the drug that this one is using? And it is different genetic line. I think right now you are understanding a bit. You are understanding some things a bit. You get genetic causes of hypertension are totally different. And the major genetic mechanism lies on renin-angiotensin and aldosterone system. Let me post it there. That is the video that will help so many people to understand about essential hypertension. Renin-angiotensin and aldosterone system. It is the main thing that people will understand. Kidney handling sodium. How are your kidney handling sodium? Are more sodium retained in your kidney? Because sodium pushes water to the kidney. Is more water retained to the kidney? And you know, when more water is retained in the kidney, you get something that is called hydronephrosis. Does it cause you to have high blood pressure? Genes affecting sodium channels, sodium transporters, and aldosterone sensitivity. Aldosterone is the hormone that regulates sodium. That can be a problem. And then we have sympathetic nervous system overreacting. You remember when you are doing this, the heart, and we said there is a system called sympathetic nervous system that makes your adrenaline to be released, increases your heart rate, and vasoconstriction. That is another system. These are systems that are automatic. No one controls them. They control themselves. So when you are excited, your brain sympathetically releases adrenaline, heart rate increases, and your blood vessels constrict. And releases, it helps your heart to pump faster. And the peripheral the vessels, the arteries, and the veins, the resistance becomes tough. These are the things that we talk about when we talk about essential hypertension. Hypertension that someone does not know the cause. It's not really means that we don't know the cause, because if you do those tests that we are talking about, you will come and understand that this person in their genetic line, they have this problem. They have this problem and they have this problem. It is called genetic or essential because when you go to the laboratory to do some tests, like the blood test, at an early times when you start to find out that you have the high blood pressure, you will see your cholesterol are normal, you can find your kidney function is normal, and you can see your cardiac output of the heart is normal. You have to go deep and do several specific tests. You have to go deep and do several specific tests, like the renin, and you know they are expensive tests, the endothelins and the enzyme tests, so that you can know, oh, in their family they have this. But the normal test that we do to know that this person has this problem, it is always normal. The test is always normal. So Anyone with any question? I'm talking so much. I've talked about abnormal blood vessel functioning, nitric oxide overproduction, endothelin function, smooth muscles contraction. I've talked about these things. So essential, let me just name them overally. Essential hypertension is brought by complications in the major genetic mechanism, the RAS system, renin, angiotensin, aldosterone system, kidney sodium handling defects, your kidney not handling your sodium well, sympathetic nervous system, always working. And you know, when people are so anxious, you are having problems with anxiety disorders, these are the things that you will be getting. And then we have abnormal blood vessel functioning, producing nitric oxide and ethylene without stability. Vascular remodeling genes. Some genes cause thickening of the arterial walls. Your arteries are very thick. Even relaxing and expanding is a problem. So the heart is using a lot of pressure to pump blood. Loss of elasticity, they can't contract and relax. And remember, we have types. We have types of polygenic hypertension. In genetics, we still have types of genetic hypertensions. Imagine, my friends, we still have types like polygenic hypertension, which is most common, caused by many interacting genes plus environmental factors. Polygenic hypertension. And then you have monogenic hypertension, mono, caused by mutation in a single gene. This is very severe. Mutations in a single gene, very severe. Onset is early. You start having, even you can find children, 19 years, 18, 17, they are having high blood pressure because of the mutation in the gene. We have something that is called, this one is categorized in something that is called the Liddle syndrome. We will go through these things and we will learn. Inherited mutation caused overreacting of sodium channels. Inherited mutations caused overreacting sodium channels. Severe hypertension, low renin, and low aldosterone hypokalemia. So this is the typical monogenic hypertension. Some genes have mutated and the factors that you have to balance your blood pressures are not there. So you start having problems. You see, Liddle syndrome. In Liddle syndrome, you have a problem with aldosterone. It cannot balance your sodium well. So you have excessive water that is retained in your kidneys. You get something that is called hydronephrosis, which brings now your BPs to go high, because your heart needs to do a lot of work to pump blood around your body. Gordon syndrome, also called pseudo hypoaldosterone type 2. We will see all this. Apparent mineralocorticoid excess. Aldosterone is too high and it's retaining so much. You see, every place we are going, we are talking about salt. Check about your salt input as you get old. Glucocorticoid, remedial aldosterone, all this, we will talk about them one by one. So we have started on essential hypertension. So be ready to go along and understand how these are. So anyone who is watching, I'll be referring to start from this video that I've started with, so that you can understand the next video. You know, teaching is a process and learning is a process. So we go slow by slowly, and you ask questions. In essential hypertension, there are risk factors that interact with the genes. High salt intake, obesity, smoking, alcohol, stress, lack of exercise, diabetes, chronic kidney diseases. All these genes are all these genes, all these problems. And if you tell someone to stop, as you get old, you need to reduce the intake of alcohol. If you are smoking, you should not even be smoking. You should not even be smoking. Imagine family history, risk of increase. When one parent has hypertension, both parents have you get married to a person, their bloodline, they have polygamic genes. The other one has a problem when it comes to retaining salt. So you fuse the genes and then you come up with a child that has both problems, and you are living sedentary lifestyle and you continue living, these children will have a problem. So we need to identify these problems. We have complications of hypertension, be it essential, be it is essential, or be it is secondary. Both complications are same. We need to know what brings essential hypertension, and we need to understand the problems that comes in essential hypertension. Complications are same, like heart disease, brain, stroke. In the heart, you'll have heart failure, coronary heart disease, left ventricular diseases. Wow, coffee cakes, welcome. Kidney diseases, eye, hypertensive retinopathy, and blood vessels like atherosclerosis, aneurysms. All these are problems that we'll have when you have. Yes, my friends, people today are learning, and I'm seeing they are finding some things so interesting. Things are interesting, my friend. You see, when you talk, you start learning, and you are getting these things right, and you are understanding them right in a right way. How do you feel? How do you feel? You feel like now, tomorrow morning, I'll wake up and join Barry walking exercise. You feel like tomorrow morning, I will wake up and join Barry walking exercise. And join Barry walking exercise so that we can have a healthy life. So, my friends, at least today we have learned about, hi, coffee cakes, you are silent today, hope you are doing good. Yeah? You see, we have learned about essential, and now it's just the beginning. Now, I've really talked a lot now. Now, ask me a question, my friends. Ask me a question. Anyone who can ask me a question about essential hypertension. Now, the problem as you have understood what genetic hypertension means. Everyone thought that genetic hypertension means you just get blood pressure from your parents. You cannot just get blood pressure from your parents. If your blood goes so high, you will have problems. Your brain will be shattered. You don't want people that have brains that are shattered. You see, we want people that have normal brains. Because if your blood pressure goes beyond and it's so high, your eyes will not see well, they will be destroyed. Ask Sha Travels. Most people that she was dealing with when she was on ophthalmology, it was because of high blood pressure. That one that people call genetic, and you don't take drugs because you are used to high blood pressure. Stroke, bleeding, your pressure goes up and ruptures some blood vessels in your brain. When it ruptures, you get stroke. And I've said one thing, all these things, be it is essential be it is essential, be it is secondary, be it is lifestyle, be it is other types. They all have the same problems. They all bring the same problems, and these problems are stroke, retinopathy in the eyes, heart diseases. All those are the problems that you can get. Blood pressure is blood pressure, but the mechanism that it comes with is what divides them. The end result is the same. What is the end result? End organ damage. End organ damage. You damage your kidneys, you damage your heart, you damage your end organ damage. So my guys, that is enough for today. What do you think? That is enough for today. I'll put that video of renin and angiotensinogen system so that you can understand how your blood pressure is regulated. So when we are talking about essential or secondary, you will be understanding. When we are talking about genetic problems and how these genetic problems are different, you now understand what I mean. So I have 9 minutes to go. 9 minutes to go. Anyone with any question? Now I have to keep silent. Anyone with any question? Anyone? Or today everyone has understood everything? Anyone who has anything can say. Anyone who has anything you can say and relate. We are learning, and some people right now are getting to know that blood pressure end results are same because you will get the same problem, but the results that starts them, the factors that starts them are totally different. You end up having every hypertension problem ends up to the same crisis. Heart diseases, coronary heart diseases, heart failure, they end up, you have retinopathy, your eyes is destroyed, you end up having all retinopathy, encephalopathy, brain destruction, all aneurysms, all they end up to the same. Heart failures, all the same. So if you are watching today, my friend, and you need to know, keep watching, keep tuning in, share this to someone who is hypertensive and someone, to all the people, so that they can understand. And there is this thing that people say, when you start, I've been told by so many people that I was given these drugs by a doctor, and the doctor told me I'll take these drugs forever. I should not stop. What do you think about that? Now that we are learning, now that we are learning, if you haven't taken your BP pill for a while, when you do it, you take it, can it cause a really bad headache? Yes, coffee cakes. If you haven't taken your BP pills for some time, you know there are some pills that are, some BP pills that bring headaches. Mostly something called calcium channel blockers and nifedipine. Nifedipine can give you a very bad headache. Why? because it means when you have not taken your blood pressure pills for some time, your blood pressure has been regulated. And then one day you just feel like, today I'm not feeling my body is okay. I think it is BP. And it is normal. Then you take the calcium channel blockers, which is nifedipine. It brings your BP so down. And you know the effect of BP is going down. The symptom that will come out is headache. Abruptly, when your pressures go down abruptly, doctor, I am sneezing and have running nose. Go and get some cetirizine, 10 milligrams. It will stop. You are having a flu. That is Abina. Go and have some. And Abina, before you go, you like. Give me the like so that you get more impressions. So that is it, my friend. You get low blood pressure secondary to the. Sometimes you can be taking these drugs. You can be taking these drugs and they give you some bad side effects. Like you are taking hypertensive medicine and you are treating the cause, and then the cause starts to heal. This is for secondary hypertension. Doctor, what is the most dangerous of this BP? Is it high or low? Both of them are dangerous. Both of them are dangerous, because if it is very low and you are not taken care of very fast, it will be fatal. If it is very high and you are not taken care of in the required situation, you will get an aneurysm or internal bleeding. So there is no one which one is better or the other one. So all these are dangerous. You see? So that is it for today. And I always answer questions about BP at 9. That is 2 hours and a half from now. 2 hours and a half from now. So everyone who is watching here, if you will be there, come with your questions. Come with, if you need to understand something, we have started on essential. This is called essential hypertension. So you who is there, you want to know more. If you are taking maybe the BP drugs and you want to know more, come around every time. Follow. If you have come late, you rewatch. And let's make it that interaction. That interaction is important. So I see there is 2 minutes to go and no one has, only one question. And I've told Abina, get some cetirizine. Cetirizine will stop the running nose and the sneezing. The mast cells are releasing so many histamine, so you stop them by taking some cetirizine so that you don't have the running nose. So for the question of Sympocate, both of them are dangerous. There is no one that is better than the other. Anything that can destroy you is not good. And all in all, thanks for my viewers. In short, never stop taking BP drugs. I've never said never stop. I've said you talk to your doctor. When you have a problem, when you follow the instructions of your doctor. People that have problems concerning BPs because there is another disease that has come, when that disease is treated and it's gone, you can be off the BP medication. But at the period that you have attained the BP, you need to take the medication. And that's why I usually say, I can't advise, I will tell you general knowledge, but if it is when it comes to prescribing the medication, I have to see you physically. If it is chronic disorders like hypertension, blood sugars, I'll give you general talk. But when it comes to prescription on chronic issues, my friend, I have to see you physically. If you have been being treated with another doctor somewhere else, you need to come and do my tests. I examine you so that I know what next. You cannot treat a patient or someone with a chronic issue if you are not having that person. You see? So good, let's meet at night. That one has been a good session of illustration. If you have come late, please rewatch. You see how blood pressure is taken. Or is there anyone who has a question before I log off? Anyone who has a question here before I log off? If you have a question, please ask. Where is your clinic based? My hospital is based along Thika Road. Just right after Kenyatta University, there is a bypass, a place called Membli. A place called Membli. If you want to see me privately, you can see me there. You can see me there. Jamaican Uncle has been there once. Go and check on Jamaican Uncle's channel. You'll see us taking Jamaican Uncle's BP measurements. So if you are on Thika Road from town, you pass, it's called the barracks, Kahawa Barracks. You go to Kahawa Wendani, you go to Kahawa Sukari, you come to you come to Kenyatta University, you take the service lane, you come to Membli. Just after the railway cross the bridge on your left, before 100 meters are gone, you will see Benhab Medical Center right there. You'll see there. You come at the reception, you ask, I want to see Dr. Ben. If I'm not there, you'll be given an appointment. But if you have my number and you can call me and give you a day. I'm eating over here. Eat. Be healthy, Dr. Jamaican Uncle. Now, thanks for everyone. Let's meet at 9. If you have been late, please rewatch. If you have a question, meet at 9 when I'm answering questions. Bye-bye. See you, my friends. Big up. Thank you for watching and being with me.